All right, let's talk about GI infections, and our team is myself, James, Sean, Shaheen, and Tiffany. So where do you begin? Well, you can group them all by symptoms, and we've sort of done that here, but the way we're going to go through them is by their, gram stains. We're going to do bacteria first, and then we're going to go into viruses later. So first, let's start with some of these gram positives that you see here. I'll try to keep this short. The first video I did took 30 minutes, and I thought no one's going to watch 30 minutes. So we'll try to keep this to 10. I can't make any promises there, but we'll see what we can do. All right, so Staph aureus, some key things to remember. I'm not going to talk about all of this, but some key things to remember are that you're going to see keywords like custard, picnic food poisoning. Really, the meat and custard, thing is kind of prominent in a lot of these questions. They have preformed enterotoxins, which means that they're fast acting. So they have these heat stable toxins and enterotoxins that are super antigens. Toxic shock syndrome can cause scalded skin syndrome, but typically with food poisoning, what you're going to see is a self-limiting. You're not going to see the scalded skin syndrome, but you're going to see these fast acting enterotoxins. And so the time course of this disease, 1 to 6 hours, things like that, is very unusual. And that's what makes Staph aureus unique as a food poisoning. So let's continue. Oh, and usually self-limiting. There are options if it does not resolve. Be serious is the classic reheated rice. It likes to grow on starches. You'll hear this phrase a lot. It has spores that germinate during the reheating process, and it likes to grow at warm temperatures. So all of that kind of allows it to be very insidious food poisoning. It has two different types of onsets that it can have. It has onset within 1 to 14 hours, but based on these two different categories, it can be the 1 to 6 hour emetic toxin, or it can be the 8 to 18 hour diarrheal toxin. You could have a combination of both, but that just sort of means that with be serious, you can, if you see really early symptoms, you can be thinking, it could be the emetic toxin, be serious. But it doesn't eliminate it if you're seeing later symptoms or if it doesn't start earlier, because they could just be, receiving more of this diarrheal toxin. It's also self-limiting, and you're going to see a lot of hydration and self-limiting here. So I'll just kind of say it quickly and move on. Listeria has this unique tumbling motility, also gram-positive. All these purple ones are going to be gram-positive here. It's going to be purple, gram-positive, as you can see over here as well. Anyway, so tumbling motility, you get it from milk. As we all know, it can grow at cold temperatures, so you think your refrigerated milk is maybe not spoiling, but this listeria is growing rapidly in there, potentially. It's penetrative. It can use these actin jets to get into the bloodstream, and it can become disseminated that way. So pregnant women are at risk of contracting it in the first place, and also vertical transmission. So, it can be really potentially lethal for neonatals, young infants. Basically, what you want to do is treat with ampicillin if that's the case, but, it's relatively rare, self-limiting for GI. Most people will have this and have a non-symptomatic case unless they're, immunocompromised. Clostridium, anaerobic spore forming, at risk for contracting it if you're very young or very old. You get it from reheated meat. The spores are highly resistant to heat. Some bacterial spores can survive boiling temperatures. That's not enough to kill them. So you have to be very careful with this sort of thing. You can treat it with penicillin and cephalosporins if you need to. Clostridium difficile. So that's C. diff, number one hospital-acquired infection. Thing to know is that it's anaerobic. It is also kind of a fecal-oral transmission, classic hospital-acquired infection, as I said. It has these two toxins, A and B, enterotoxin and cytotoxin, that damage the intestinal mucosa and do reduce actin polymerization, or they depolymerize the actin in your cells. So that's actually two of their main virulence factors. Produces a lot of severe watery diarrhea, and you can treat it with metronidazole, Vanco, and the antibiotics is usually how you get it in the first place. So you kill off your natural flora, and you end up getting some small population of C. diff that lives inside of you it basically outgrows its kind of natural niche in your internal environment and takes over the intestines, specifically colon, colitis. Vibrio cholera. Okay, so now we're going to talk about a bunch of these comma-shaped rods. As you can see, a little comma shape here. Cholera has a little flagella on it. They're modal. Actually, sorry, it has these fimbriae. I think those may or may not be flagella. I think those are just smaller ones in the background. But it has these fimbriae it uses to adhere to the intestine. It does not invade, but it adheres to it, and it produces this sort of watery but non-inflammatory. It's called rice water, and so you might think there's white blood cells in there, but it's not. This diarrhea is actually non-inflammatory. Little bits of mucus are perhaps what makes it this rice water consistency. Gives you extreme dehydration. The main thing with cholera is to hydrate people with clean water. So risk factors are developing countries, as you can see here, and seafood in more developed countries. And the developed countries is because they don't have the same water system. So water purification to get rid of fecal matter and really sterilize before returning it to homes, etc. is the key way to reduce this. Helicobacter pylori. This is an interesting one. It lives inside of your stomach. About 50% of people have it, according to some studies, and 90% of those people are asymptomatic. So it's sort of just like an endogenous bacteria, meaning natural part of your flora in half the population about. And so it's another curve-shaped gram-negative rod. This one can be identified with multiple flagella. Now that picture's kind of a cartoony looking one, but it gets the point across. What I like to think about it looking like is when you see this gram-negative rod, and now we're in the gram-negatives here. I kind of didn't make that clear. This guy has these 4 flagella in these pictures, typically at least. And so I think that sort of looks like a helicopter to me. And anyway, so that's how I remember Helicobacter pylori. It sort of looks like a helicopter flying around doing his thing. Anyway, so moving on. We have these are endogenous bacteria. A lot of people have them. The things to remember is that they bind to the surface of the GI epithelial cells, specifically typically in the stomach itself, sort of near the duodenum, but in the stomach. And they can put you at risk of all sorts of anemias, iron deficiency anemia. You can get B12 anemia from this because of the importance of sort of the stomach and acid balance in which they disrupt. And let's see, you can also get, ulcers and GI bleeds, so that can lead to intestinal bleeding, which obviously in turn leads to iron deficiency anemia, And so diagnosis is this thing called urea breath test, stool antigen and ELISA, which is a common answer for a lot of these. You can pick it up in the stool. Manage symptoms and decrease stomach acidity. So there's this triple treatment, PPI, amoxicillin, and clarithromycin. Now, I'm honestly going to stop talking about the treatments so much because really it's about identifying these guys. A lot of them are self-limiting treatments. Moving on to Campylobacter jejuni, another comma-shaped rod. So what do you need to know? It can be grown at 42 degrees Celsius, which differentiates it from the other rods. Also, it's associated with chicken and uncooked poultry. Also, it is invasive. So you're going to get bloody stool and bacteremia, and you can also get it from contaminated water. But the classic sort of keywords and problems are often like chicken and poultry and things like that. So bloody stool, it incubates for days, so it's usually a slower onset. And you can get this ascending paralysis as well and demyelination of the PNS, which is quite serious. So you treat this with macrolides, and it can be also self-limiting as well. Salmonella typhi. Salmonella typhi, so we'll talk about salmonella. We'll briefly talk about the enteritidis one, which is more common, but right now we're talking about the typhi one. So that has a motile flagella. It is penetrating. It can invade the Peyer's patches and M cells. It's facultative intracellular. And what's the main important thing to know? Probably that it colonizes the gallbladder, causes typhoid fever, it only has watery diarrhea despite the penetration, okay? So it's only really a watery diarrhea here. Although it is this pea soup diarrhea as well, which I forgot to put in, or somebody forgot to put in these slides. Maybe me, maybe not. Anyway, so the pea soup diarrhea is this classic phrase you're going to hear. Disgusting sounding, and I encourage you to Google image that. It gets even grosser. But, helpful to know. If you have a patient that comes in with pea soup diarrhea, they're not going to tell you in the real world with a question stem that it is that. So you're going to have to be able to Google image that and really understand the inner workings of pea soup diarrhea in order to diagnose it and name it as such on your own independently. Anyway, you can have fun with that on your own time. Typhoid fever. What do we say? Here we are. Oh, it can also have cutaneous rose spots. Sorry, I skipped down here. Cutaneous rose spots. And you treat with fluoroquinolones or cephalosporins in supportive care. Moving briefly on to Salmonella enteritica, and I don't know why it has such a small little corner of my slide, but it does. It's important. It causes all sorts of disease outbreaks in the United States every so often. FDA food process breaks down, and we get some of this, in our meat. We can get some of this in, vegetables and poultry and undercooked egg, as you classically hear about, the rocky raw egg, blended up in a shake. Maybe don't do that because of salmonella. So that's what we're talking about, Salmonella enteritica. And anyway, it is more common, a little bit less lethal, and you're going to get watery diarrhea, but no cutaneous symptoms from this one. Let's continue. Yersinia. Okay, I'm at 10 minutes now. I'm going to try to keep it to less than 15. So Yersinia is stool culture diagnosis. You're going to see these hairpin structures that are gram-negative, urea positive, classic daycare center thing. It can mimic appendicitis. You get it from puppy feces, undercooked pork, and unpasteurized milk. YOPs, you'll hear this. So these YOPs, which is really just Yersinia outer proteins, are secreted through a type 3 secretion system. That comes up a lot. And let's continue. Shigella. For Shigella, things to remember is that it has the famous Shiga toxin, and that inactivates the 60S ribosome and decreases protein synthesis. It invades the Peyer's patches, so it's invasive. What you're going to get is a hemolytic uremic syndrome, and rehydration antibiotics are not common unless severe. You can also get bloody diarrhea, because you should have had that here. I don't think we have that, but bloody diarrhea is a very important component of this as well. I'll just put it as underlining it in red to show that. Diagnosis is stool culture, antigen test, etc. Now, here's the thing. You're not going to use antibiotics unless it's super severe, because you can increase the risk of the hemolytic uremic syndrome, so don't do that. A lot of similarities between the previous one, Shigella, and EHEC. So we call this EHEC because enterohemorrhagic E. coli. And so EHEC is a specific one that we care the most about is O157H7, because this particular combination of antigens and proteins makes it a little bit more lethal than some of the other versions of E. coli. And yes, sure, it's going to be pink on McConkey's auger, but that's not going to distinguish it from the other ones. So you're really going to need to do an antigen test, as we say down here, to distinguish it from the others. And so you're going to get these O157, which is basically talking about the lipoproteins, the O, and the H is the flagellar antigen 7. Anyway, so contaminated beef, that's where you're going to find it, and it doesn't take a lot to get you sick. Going to give you bloody diarrhea and HUS, just like Shigella. Let's continue. Oh, and that's very serious, can lead to renal failure. I don't know if I mentioned that before. And so the antibiotics may increase that HUS, that hemolytic uremic syndrome. So you probably don't want to use antibiotics. It says careful fluid, so it should say fluid management. And so that's what you want to do. Avoid antibiotics with those two. Now, talking briefly about Giardia, it lives around us. It looks like this. It lives in the water supply. And, not in the water supply. That makes it sound like it's in your home and your pipes. It's in the natural water, freshwater ecosystems. So if you're going on a hike, it's in the streams, etc. That's why you bring iodine. Chlorine's actually not good enough, interestingly. It gives you this fatty diarrhea that's foul smelling. So those are some of the key words. Or, one of the key things with Giardia is just knowing its very unique look. So that's also how you would diagnose it potentially on stool O&P, or you could use an ELISA test as well. Entamoeba histolytica is, an amoeboid version of basically dysentery, because it's amoebic dysentery because it's got bloody diarrhea that you can get. It causes serious liver complications as well, and this anchovy paste abscess is something that you can get in your liver. It kind of migrates back and forth between your liver and your intestines, so it's got this ongoing reproductive cycle inside of you. And Entamoeba histolytica can also be identified on stool O&P by these red blood cells that are inside of it, engulfs the red blood cells, and causes some pretty serious damage to your intestines, your colon, and your liver. Stay away from California and Texas, which are the only two places in the United States where this is known to be kind of more prominent. All right. And how do you get it? Well, water supply once again, and it can also be a sexual fecal oral thing as well. Now talking about a couple of viruses here. Rotavirus, we vaccinate for this one, so you don't see a lot in the United States, but you can have an increased prevalence in developed countries or developing nations. It's a fecal oral thing, common in daycare centers, kindergartens, and contact with children is one of the main risks with this, so, stay away from those rugrats. All right, it causes non-bloody diarrhea, watery. It's a self-limiting thing, and you're not going to see as much of it because we have a vaccine for this in the United States. So you see less of this and more of norovirus, which has very similar symptoms. So we do not vaccinate for norovirus. There is no vaccine for norovirus, whereas all children get this, typically during, if they're on the right vaccination schedules in the United States. There is no vaccine for norovirus. You can get this from cruise ships, kind of a similar time course of disease, I think, 24 to 48 hours. So usually on the order of days after exposure, you're going to have the nausea, vomiting, stomach pain. So kind of a whole host of symptoms. It's a self-limiting thing, though, usually gone within 3 days. All right, so now some questions. We're at 16 minutes. It's going to be a 20-minute video, unfortunately. Sorry, guys, if you're bored, if anybody's still watching. Practice question 1. Patient presents 24 hours after returning from a summer road trip through southern Maine with bloody diarrhea after consuming a variety of foods in the past 24 hours, including chicken, milk, vegetables, seafood, and rice. Culture of the probable organism is a gram-negative, comma-shaped rod, oxidase positive, and grows well at 42 degrees Celsius. Given the description, which food was most likely the source of this person's infection? Well, I would just run through this and say, what's helpful? Presenting within 24 hours, that's key information. So here, I'll put that there. Another thing is that 24 hours, though, is kind of right on the edge of some of these longer onsets and some of these earlier onsets. So it's not super helpful. And within the past 24 hours, they, had a variety of foods. They're sort of unspecific about what meals, was it breakfast, lunch, or dinner, but they list all these things here. So that's not really going to help you differentiate too much because, it could be listeria from the milk. It could be E. coli. It could be all of these things. It's not really specific enough to any one thing. So what we're going to have to go with is obviously this stool culture, which is super helpful. Something growing at 42 degrees Celsius right there should tell you. But even if it doesn't ring any bells for you, the fact that it's a comma-shaped oxidase positive rod, gram negative, actually, they didn't say rod, but it's comma-shaped. Oh, yeah, comma-shaped rod, sorry, right there. Duh. And it's oxidase positive. So this is basically going to lead you right to Campylobacter jejunum. And then where is that most likely, coming from? Typically poultry. It grows in the GI tract of chicken and other birds. So it is something that's sort of natural flora for them. So the correct answer here, you guessed it, that was poultry. Let's continue. Practice question 2. 65-year-old woman presents to the ER with suddenly experiencing severe abdominal pain, vomiting and nausea. She explains that earlier in the day, she attended a PTA picnic. So earlier in the day, I just want to pause it here and say earlier in the day. This is all happening very fast within 24 hours, right? She attended a picnic where they were served deli sandwiches with mayonnaise, and indicated that some of the other attendees reported feeling unwell. So if some of the other people that were at that same event felt unwell a couple of hours after the event, Well, that tells you have a very short time course, right? Unwell, a couple hours later. This is all pointing to this picnic clearly. And one of the shortest term things that you have is one of the shortest terms forms of disease is you basically should lead in the direction of either Staph aureus, or you're thinking maybe this really short onset, this could be a B. serous thing, but they don't really mention reheated rice. And so probably when you see this, what you should be thinking is Staph aureus, which is a gram-positive cocci right here. So we'll just highlight that one. And I will remove this little thing. And there you go. If you have any questions, feel free to email us. And thank you for watching.